Hello friends, even in individuals with perfectly healthy heart, sometimes they might just experience a sudden change in the pattern of their heartbeat. It's a momentary change for a few seconds. What happens is, for a few beats, the heart got accelerated, followed by a missed beat and then a much stronger beat. If this is a one-off event, an isolated incidence, then it is generally regarded as a benign phenomenon, and if it continues to occur, if it's a recurring event, then it might be considered as a manifestation of a serious underlying heart pathology or a serious cardiac condition. So this video will deal with the phenomenon of such extrasystoles, whether they are considered benign or when they are considered as something serious, a serious heart condition, and what is the pathophysiology behind such extrasystoles. If you are a first year student, it's a part of Physio++. If you are a second year student, it will be useful to write in your pharmacology papers. If you are appearing for medicine exam, this will be a part of arrhythmias. It's called extrasystole. Now, what is extrasystole? The name itself suggests that it is within the regular heartbeats. When the heart is beating regularly, suddenly there is an extra beat. You know that the heart excites in a regular fashion. There is an electrical excitation spreading in the heart, followed by the mechanical event of systole, the cardiac contraction, and then the relaxation. So this extrasystole means there would be an extra depolarization spreading through the heart, and it may also result in an extra beat, an extra cardiac contraction or systole. So caused by an after potential. What is an after potential? You can see in the diagram that there are regular impulses in the heart, spreading in the heart. Suddenly, after one excitation, immediately there is an extra depolarization. So this is an extra premature depolarization. Premature because it is occurring before its time, before the regular time. So it's called as a premature depolarization. And it may occur in the ventricles. So it's called as ventricular premature beat, VPB. Or if it occurs in the atria, it's called as the atrial premature beats, APB. Or some authors also prefer to call it VPCs, ventricular premature contractions. Now, as I said, if it occurs as a one-off event just once, then it is taken as a benign phenomenon, and no further intervention is required. But if it occurs in 3 or more successive beats, 3 or more successive consecutive cardiac cycles, then it's called as a run of extrasystoles, and that is when it might be an indicator of a serious heart ailment and an intervention becomes necessary. Why does it happen? Well, cardiac glycosides digitalis is given in heart failure conditions, and this side effect, extrasystole, is said to be a side effect of digitalis, because digitalis is known to act by increasing the intracellular calcium. It causes an increased sarcoplasmic calcium, and that is how it increases the myocardial contractility. But as a toxic effect of this, you know, calcium, in the case of heart muscle, calcium is involved in the electrical event, that is electrical excitation in the myocardium, and is also involved in the contractile event in the heart. So extra sarcoplasmic calcium is said to be responsible for this extra depolarization occurring in the heart. That's one common cause of such extrasystoles. Now, when is it that the extrasystole might lead to some serious tachycardias or serious rhythm disturbances, dysrhythmias? Extrasystole occurring at the peak of T wave is likely to degenerate into ventricular fibrillation. Why is it that extrasystole or premature depolarization occurring at this point of time is likely to degenerate into fibrillation? Is because, look, T wave represents ventricular repolarization, and when we say peak of T wave, means T wave is half complete. It means ventricular repolarization is half complete or partially completed. It means that some fibers have been completely repolarized, some fibers are partially repolarized, they are still repolarizing, and some fibers are still in a depolarized state, they are yet to start their repolarization. This is said to be a chaotic condition in the heart. Every fiber has different membrane potential, and if this extra potential occurs at this point of time in the heart, then it is likely to create multiple reentrant circuits or multiple foci that will discharge impulses spontaneously, and that then will result in the fibrillation, which is a serious arrhythmia. It can also be fatal. Now coming to the physio plus part of this, the physiology behind this extrasystole. The extrasystole is ventricular extrasystole is followed by a compensatory pause. As I mentioned in the beginning, there would be a pause, a missed beat, and then the subsequent beat will be much stronger. Let's see the reason behind it. Extrasystole is followed by a compensatory pause. Why is that? As you can see here, that SA node is generating the impulses and sending into the ventricle, and then there is ventricular excitation which is going on in a regular rhythmic pattern. You can see after the second impulse and second beat, there is this extra depolarization. Now, when this extra depolarization has occurred spontaneously in the ventricle, and let's put it in simple terms just to understand, SA node, which is located in the right atrium, is not aware of it. This is just a simple language, just to clear the things in simple manner. SA node is not aware of this. It's situated in the atrium. So SA node sends the next impulse at its normal time. As you can see here, first impulse, second impulse, third impulse from the SA node was sent at a normal time, at its normal time. What happened is, because of this extra depolarization, ventricles were thrown into refractoriness. Now let me just add one or two sentences here. What is refractory period? After every excitation, immediately there is a time period when a tissue cannot be excited for one more time. That period is a refractory period. Now you can see here that because of this extra depolarization, immediately what follows is the refractory period of the ventricle. During this time, the next normal SA nodal impulse came into the ventricle. It finds the ventricle into refractoriness, so it will not create one more impulse as the regular excitation, so that beat will be missed. It's a missed beat, and this pause is called as the long compensatory pause. And what you should note is that the next impulse and next beat, next impulse will generate the next systole, the next beat will be almost 150% stronger. Why is that? The answer is Frank-Starling law. Because of this long duration of asystole, that is, the heart was in diastole, the ventricles were in diastole for a longer duration, and they were in diastole means the filling was much greater, because diastole duration was long, so there was a greater filling. And as you know, greater the filling, greater the end diastolic volume, stronger will be the next systole, Frank-Starling law. And the stronger beat will have a greater stroke volume also. But remember, because of this missed beat, when the ventricle was in diastole, ventricles were in diastole, there was an extra filling of blood during this time. So the long compensatory pause will be followed by a 150% stronger beat. And the reason, Frank-Starling law. I have also made the video on Frank-Starling law. You can refer to that. What's the reason for this stronger contraction of the heart? And finally, the atrial premature beats or atrial extrasystoles. Atrial extrasystole is not followed by a compensatory pause. Why is that? As I said, SA node is situated in the right atrium. Okay, so it knows in a way what is going on in the atria. It was not aware what was going on in the ventricles, so it kept on discharging normal impulses at its normal time. But in case of the atrial extrasystole or atrial premature beat, as you can note here, that SA node generates the impulses at, let's say, the intervals of 1 second. So SA node and excitation of the atria, SA nodal impulse, excitation of the atria, and then there is this extra beat, extrasystole occurring in the atria this time. Now since SA node is a part of the atrial musculature, or it's embedded in the atrial wall, it knows that extrasystole has occurred. Now this is to explain in a simple language, I repeat once again, SA node knows about it, that the extrasystole has happened and the atrial musculature will be immediately going into refractory period. So what it does, it gets adjusted to this extrasystole. See in this diagram, representative diagram, 1 second, then the next impulse, then after 1 second the SA node was expected to generate the third impulse, but it does not do so. It gets adjusted to this extrasystole and extra depolarization of the atria, and therefore after the refractory period is over, then SA node generates the next impulse. Normally SA nodal impulse would have come at this time after 1 second of the previous impulse, and it would have found the atrial musculature in the refractoriness, so that would have created a compensatory pause. But no, what instead happens is that SA node counts 1 second after this extrasystole, and then from that 1 second time it generates its next impulse. So SA node adjusts to the extrasystole in the case of the atrial extrasystole. And I repeat once again, I just said this to put it in simple language, that SA node does not know what is happening in the ventricles, but SA node knows what is going on in the atria, because it is embedded in the atria. That's how you can remember these things of related to the compensatory pause. So that was a quick summary of the extrasystole or the premature beats. And more such videos about the digitalis toxicity and pharmacology part and medicine part are coming up soon.